It most often develops in children during the growth spurt just before puberty, but some adults can suffer from scoliosis too, and it can largely impact everyday life. Joining me to tell us more is Dr. Pickelman from the Florida Mayo Clinic. Good morning.
Hey, good morning.
So what is scoliosis and how does it affect adults?
Well, quite simply, scoliosis is a curvature of the spine, defined as more than 10 degrees of curve in either the lumbar or the thoracic spine. And I think most people think of it as primarily being a childhood or adolescent type of disorder, but actually it's much more common in adults without a prior history of scoliosis. As we all age and develop degenerative changes in our spine, we can also develop curvatures in the spine, and that can affect adult life, especially as we get later on in our adult years with respect to back pain, and sometimes leg symptoms go with it.
So how do you know if you have scoliosis, and what are the symptoms?
Scoliosis itself oftentimes doesn't cause a lot of symptoms other than back pain or sometimes leg pain, particularly in adults. Children will oftentimes notice that their clothes aren't fitting as well, or their shoulders are not level with the floor. One shoulder will be higher, or they'll have some rib prominences. But most adults don't necessarily have an outward manifestation of scoliosis like children oftentimes do. So they'll typically present more with back pain, worsened back pain, sometimes a loss of height as the scoliosis progresses, and oftentimes symptoms going down the leg, such as sciatic pain.
And what are the treatment options?
It's really a multidisciplinary approach to treatment of scoliosis patients. So oftentimes physical therapists, physiatrists, pain medicine specialists, sometimes psychologists, and oftentimes neurosurgeons will all kind of come together and develop a treatment plan for each individual that fits each individual patient. So the typical treatment early on is non-operative with respect to core strengthening, weight loss. Sometimes injections are a part of that, yoga, other types of exercises, and only when those fail do we start considering surgical interventions depending on what the symptoms are.
So what are some lifestyle changes people can make to ease the symptoms if they have them?
Well, weight loss is a big one, especially in our day, to try to take some of the stress off the spine. Other types of things that we focus on are core strengthening types of exercises to work on the abdominal muscles and the muscles in the back part of our spine to try to help balance them out and take some of the stresses off the spine. Flexibility types of things. I'd mentioned yoga and Pilates earlier are helpful in maintaining that flexibility. But other than those types of things, there really isn't a lot you can do to prevent the scoliosis or to prevent its progression if it's going to go in that direction.
Thank you so much for your time and information, Dr. Pickelman.
Thank you. I appreciate you having me.
Mike?